buenos días a todos y todas. Sean bienvenidos y bienvenidas al cuarto día del Foro de Salud Digital RECAINSA 2021, Salud Digital para Todos, en el marco de la celebración de la Semana de la Salud Digital, organizado por Transform Health y toda la coalición de organizaciones, entre ellas la Red Centroamericana de Informática en Salud, RECAINSA. Yo soy Jocelyn Carías, gerente general de la red, y hoy tendré el gusto de compartir con ustedes la agenda del día. Hemos desarrollado y organizado una agenda llena de actividades de muchísimo interés para todos los que trabajamos en proyectos relacionados a la salud digital. Y bueno, para comenzar, quiero contarles que hoy vamos a tener dos conferencias magistrales, 3 paneles de discusión de súper lujo y al final de la jornada un taller interactivo. Para comenzar, vamos a estar conversando sobre infodemia en la salud pública, su impacto global y cómo manejarla. Esta conferencia va a estar a cargo de Tina Pernan, quien es la Team Lead Infodemic Management en la Organización Mundial de la Salud. Luego tenemos un panel de discusión, uno de los paneles, podemos decir, de los paneles más esperados del foro. Vamos a estar conversando sobre el rol de la cooperación internacional en la transformación digital en salud. Tenemos unos invitados de súper lujo, entre ellos el señor Tim Wood, quien es Senior Program Officer en la Fundación Bill y Melinda Gates. Tenemos como invitada a Rebecca Disler, quien trabaja como Data and Digital Health Strategies en la Fundación Patrick J. McGovern. Tenemos también con nosotros a Adele Wagman, quien es la Senior Digital Health Coordinator en USAID. Y para cerrar con broche de oro este panel, tenemos como invitado al señor Roberto Tapia Conyer, quien es el director general en la Fundación Carlos Slim. Este panel va a estar moderado por nuestro director ejecutivo, Daniel Osoy. Y después vamos a estar conversando sobre un tema de muchísimo interés y que en lo personal estoy tratando de impulsar desde el trabajo realizado en RECAINSA. Vamos a hablar sobre transformación digital en salud con equidad, para lo que hemos invitado a 3 extraordinarias profesionales trabajando en proyectos de salud digital en distintos sectores. Vamos a tener con nosotros a Andrea Barbiero, quien es una innovadora y consultora en temas relacionados a salud digital. También tendremos con nosotros a Mirna Martí, quien es una consultora internacional para la Organización Panamericana de la Salud. Y finalmente tendremos con nosotros a Giselle Barrantes, quien es la líder del proyecto EDUS en la Caja Costarricense del Seguro Social. Luego tendremos el tercer panel de discusión del día, en el que estaremos hablando sobre interoperabilidad en salud en América Latina. Y vamos a estar conociendo sobre algunos casos de uso en nuestra región. Otro panel conformado por extraordinarios profesionales de nuestra región. Tendremos al ingeniero Fernando Portilla, quien es consultor internacional, especialista en interoperabilidad. También tendremos con nosotros a Daniel Risato, quien es consultor internacional y actualmente trabaja para la Organización Panamericana de la Salud. Y también tendremos como panelista al señor Eric Ramírez, quien es consejero técnico senior en sistemas de salud en Palladium. Este panel estará siendo moderado por mi colega y amigo Alejandro Benavides, quien es el cofundador y el Deputy Director en Recaíza. Finalmente, para cerrar con broche de oro este día, tendremos una conferencia magistral a cargo de Víctor Medina, quien es el presidente del capítulo de HL7 en México, y estará conversando con todos nosotros sobre el estado de la situación en la adopción de HL7 y FIRE en México. Así que no se pueden perder la agenda. Para todos aquellos que se registraron en nuestros talleres interactivos, a la 1 en punto CST, vamos a dar inicio con el taller de hoy. Hoy estaremos hablando de un tema muy importante para todos los que estamos involucrados en el desarrollo y en el impulso de la salud digital en nuestra región. Hablaremos sobre privacidad y seguridad de los datos de salud, aspectos éticos y legales. La docente a cargo de este maravilloso tema es la doctora Marisa Eisenberg, quien es la directora académica del Observatorio de Salud de la Facultad de Derecho en la Universidad de Buenos Aires. Así que si están interesados en unirse a este taller, vayan a nuestro sitio web fsd.recainsa.org y regístrense. Y bueno, para dar inicio a la agenda del día de hoy, quiero presentarles a nuestra invitada de hoy. Tiene un currículum impresionante y en respeto al mismo lo voy a leer. Tina Pernand es jefa de equipo de gestión de la Infodemia en la unidad de preparación para eventos de alto impacto en el Departamento de Preparación para Peligros Infecciosos Mundiales en la Organización Mundial de la Salud. Tina ha trabajado durante más de 20 años en la OMS, la Unión Europea y el mundo académico. Su experiencia combina la investigación en salud, el análisis, la salud digital y la elaboración de políticas, haciendo hincapié en el uso eficaz de la información y los datos sanitarios en la toma de decisiones. Como parte de la respuesta al COVID-19 de la Organización Mundial de la Salud en los años 2020 y 2021, Tina trabajó en el desarrollo y en la formulación de la respuesta infodémica de la OMS y los enfoques basados en la evidencia para las intervenciones de gestión infodémica, por lo que recibió el premio Pathfinder e Innovación de la OMS en el 2021. Tina no está en vivo, lamentablemente por su agenda muy ocupada, no nos está acompañando en este momento. Ella, como comprenderán, es una alta funcionaria de la OMS. Sin embargo, el interés que ella tiene en nuestra región nos permite estar con ella a través de un video. Este video, es importante mencionarles que fue grabado en inglés, pero tenemos traducción simultánea, interpretación simultánea, perdón, para todos ustedes, así que pueden seleccionar el idioma de su preferencia. Los dejo entonces con Tina Pernand. Muchísimas gracias.
Hi, my name is Tina Pernand. I'm team lead for infodemic management at the World Health Organization in Geneva, Switzerland. And thank you for having me today. I'm sorry that I'm not there with you to be able to discuss. So I'd like to talk to you today about the infodemic, how it relates not just to public health, but also digital health and health informatics, and how we as health informaticians can do something and contribute something to managing it. So, over the past 22 months or so, we've all worked and lived through a total societal event, and we still are. It's really been the first time when, as public health practitioners and as people, we faced really the full impact of how much technology progress has changed how we connect with each other and how we make decisions and how we enact health behaviors and how we influence each other in personal and professional spheres. So in effect, we've experienced amplification and spread of information of all kinds. And this includes concerns and questions, rumors, misinformation, and information of varying quality. So we describe this phenomenon as an infodemic. And early last year, we knew from past experience that rumors and trust influence how effective we are in engaging with people that are affected by an epidemic. And these rumors and trust also influence the uptake of epidemic management measures by people, and by consequence, they influence ability of health authorities to manage epidemic risk in communities. So in a protracted pandemic, responders and health systems are exhausted and people have faced adversity from loosening of social cohesion and threat to livelihoods. And even now in November 2021, the COVID-19 infodemic is starting to blend with COVID-19 vaccine infodemic, with influenza infodemic, and with wider political and societal challenges that we're facing. As we discuss building back better after such a total society event, and as we recognize that we need to understand and support resilience of health systems and communities, I would also argue that we need to think about how this can be done within the influence of the digital information ecosystem. We know that our epidemic management tools need to be more effective, and they can be more effective if we recognize that societal dynamics influence how public health system works, how effective it is. So, we can't solve societal problems all through the health system, and we certainly cannot solve the infodemic through the health system alone. But it is our responsibility as practitioners to think about what is in the domain of influence of health authorities or public health or digital health, and can be changed so that we can promote better uptake of epidemic mitigation measures by people, by vulnerable communities, and of course by society. So really, we as practitioners are challenged to imagine how can we ensure higher uptake of vaccines and public health and social measures and pharmaceutical interventions. Now, the infodemic is a global phenomenon, but to reduce its harmful effect, we need everyone involved. We need all parts of the health system involved. We need all parts of society to get involved, and we need to manage it across multiple levels and communities, from local to global. So this phenomenon is really complex, and it also means that the managing of pandemics is really complex and difficult. It's also very difficult to create an environment that supports healthy behaviors, because ultimately the harm from infodemics stems in enough people changing their behavior in a particular way that can lead to harm. And of course, this works also the other way around. The way out of the pandemic is actually collective behavior when enough people change their behavior in accordance to public health guidance. So the way that I like to think about this is that actually we as public health practitioners work at this interface between society and populations. And the way that society functions, of course, is changing all around us. And therefore, we also need to think about how this is pressuring us to consider changing the way that we work in public health. Now, during the pandemic, we've actually experienced a perfect storm. It was a perfect, or it is a perfect storm that makes it really hard to encourage healthy behaviors in the population. And it has several layers. The first layer of thinking is that we have a global pandemic that is changing by the minute in terms of its effects and what we know about it. It is transpiring differently in different parts of the world. And it's being largely understood through the internet. So we health authorities like WHO and other organizations must communicate about what we know about the pandemic. That's our main, that is one of our fundamental responsibilities. But at the same time, we know that local television or local internet coverage would top up that information for people in specific locales and telling them what they should be taking on board. So the problem is that the global flows of information move faster than the local response. So you can be living in Pakistan and find out what the US CDC thinks of COVID-19 before you know what the health authorities in Lahore think you should be doing. Now, in the second layer, we also need to understand that the historical trajectory of this particular virus and disease lent itself to a lot of country against country narratives, so geopolitical dimension. And conversations and narratives have been changing depending on what month and what year we are in. For example, things like whether it's the Wuhan virus or the Indian or South African variant. And this is why things like insisting on correct nomenclature for using terms like COVID-19 or the Delta or Omicron variants is really important. This is not just splitting linguistic hairs, it's actually making it clear that we need to separate out scientific information that can save people's lives, that we separate this from stories and rumors about neighbors who we are in struggle with and these stories that sell media. And then the third layer is that it's important to, I think, as much as possible, to make a distinction about information, misinformation and disinformation. This is because disinformation is intentionally and maliciously placed, and it's absolutely part of the information warfare strategy that's happening around the world. There's no doubt that malicious actors connected to extremist movements, race narratives, and gender superiority narratives, or that all of that kind of things. But it's also important to realize that misinformation, for all we know, can hurt just as many people as disinformation. It's kind of scary to think that way because we like to often think that disinformation is more serious and misinformation is less serious. But the thing is, you still have harm at the end of both of those, whether there was intention or not. So we can see in local context how misinformation has been playing out around the world in terms of regional disputes about who's going to get the vaccine first and who has to wait. Or you're seeing it in terms of dispute about which is more important, like being able to find food and shelter or being alive, to have those things. So you're in that environment. People are fatigued, and it's really hard for them to think critically because they're being pulled in a lot of different directions. And, we couldn't really cook up a more perfect recipe for misinformation to spread, actually. And, it's also been a perfect recipe for straining the health system and the relationship between people and the health system. So then, how can we health informatics professionals, digital health professionals, even deal with this big challenge? What can be our contribution in addition to everything else that we're doing? Well, first, when we're thinking about it, we do need to sort of keep in mind that the technology progress, the technology has changed the way that information is produced, distributed, and consumed. We, as digital health and informatics practitioners, probably are a lot more comfortable with the concepts related to information circulation and the structure of the internet. But the reality is that this overabundance of information, just the way that the sheer digitization has affected us, that really is giving way to online and offline flows of information that really affect, we don't just observe them in the digital space, but then really affect offline behaviors. And even before the pandemic, when we were discussing digital transformation and the digitized society of the 21st century, we started seeing how much the technology has really impacted societal aspects, societal characteristics, how we interact, how people build different identities in different communities, how, you know, the dimensions of digital divide and digital inequalities weren't defined anymore by whether or not people have access to the internet, but it really actually went deep down into people's skills in how to use technology and also skills in order to translate use of technology into favorable outcomes for their health or for themselves. And one thing also to remember is that in public health and in information science, you know, discussions about how the internet and the digitization may affect the public health practice, they date all the way back to 1998, and this was the era of real social web 2.0, where a lot of people nowadays actually don't realize that we've evolved through several generations of the concept of the internet. And now, you know, the things that really affect, or the design of the digital platforms really affect or they play on the characteristics and the psychological characteristics that play on emotion. Content that is more emotive is more successful, is more propagated, and algorithmically promoted. So in this type of an environment, even without having any other major interventions, it's really hard in this type of a personalized ecosystem to really compete with lower quality information. It doesn't even have to be misinformation, but just channeling the more boring factual health information to people digitally is a problem. And you know what we really seen really over the last 10 years or so is this accelerated change in the information ecosystem. So, you know, when in 1980, when smallpox was declared eradicated, we were living in a completely different media environment, in a completely different information ecosystem than now. And because the world has changed so much, the diseases have changed, and that also means that we need to change or adapt our capacities for preparedness and response. So at the beginning of the pandemic, when we started thinking about the infodemic, we really thought, you know, okay, most people think that the infodemic or the information floats in fairly hierarchical way, actually linear like this, but the reality is more similar to this. So this is an actual social network analysis on Facebook, and the blue dots are people that represent pro-vaccination views in this network. The red dots are those that are against vaccination, and the green ones are those people that are undecided. And this type of analysis actually, and this type of depiction allows us to understand that actually the blue dots actually talk mostly to people of the same opinion. We talk to each other. But the red dots are much more intertwined with the undecided. And this was the situation even before the pandemic. And this analysis has been repeated since, and it basically showed just tightening. Red and the green is a lot more interconnected, but the blue still is quite detached. This is a type of analysis that actually we need in order to be able to help health authorities and public health practitioners understand where the pain points are in the information ecosystem and do something about them. So the same authors that made that analysis that I just showed also gave an update at the last WHO Infodemic Management Conference on their further analysis, and what they expanded, for example, that computational approach to span users across 6 social networks. And through this type of analysis, they were able to actually see that it's not just about information flowing across the platforms, but being actually able to identify very small, extremely small communities that are bridging between people that are undecided and people that are anti-vaccination, for example. Things that with the traditional approaches to analyzing social media, one would just never be able to pick up. Now, why am I showing this? Because I think if we want to successfully address the infodemic, and this is actually a task of all of us, not only health informaticians, is that we really need to, in this urgency, in these urgent times, really focus on what is in the control or in the domain of the health authority to take action on to promote healthy behaviors. So one such thing when it comes to the infodemic is being able to identify where are people asking questions, expressing concerns, or confusion, but they're not actually getting health information, reliable health information, in order to satisfy this need for information. So these are called information voids. And if we do not proactively identify these and provide information to people when they're searching for it, when they're needing it, then that basically creates a vacuum that very quickly is filled with rumors and misinformation. So if we want to be in this world of really abundance of information, the chaotic internet, so to say, if we want to proactively manage the infodemic, we need to find and develop better real-time tools in order to support health authorities to more quickly, effectively place the health information that people need to them. So at the beginning of the COVID-19 pandemic, I actually worked in the digital health and innovation department in WHO, and was seconded into the response. The first task, the first objective that I received was to think on what would be an innovative or a new way of looking at identifying what proactively what are the topics that are gaining in traction, in interest of people, and how and which ones would be the ones that we would need to actively engage with on the internet. So we developed, we adapted the current approaches to analysis of social media online, but specifically took a different view of generating insights that would allow proactive or just-in-time information. So we did that through public health taxonomy that's referenced here, and you can read in the papers. But more importantly, we also tweaked a little bit, and we were looking for content or narratives that were gaining in velocity, not in volume, but those that were very small, but they were gaining in interest, gaining in velocity, looking at emotion expressed and looking at questions. And of course, that type of approach can be then implemented through a variety of technologies. And this is, for example, an example pilot platform that currently WHO is testing on 30 countries that basically uses this approach almost in real time to be able to find topics that are accelerating. And where we can make a really big difference from the informatics perspective is also generating new sources of data, not just analyzing existing ones. One thing that, for example, I also forgot to mention that has been very helpful during the pandemic is mobility data analysis, for example. But this what I'm showing now is an example of a project, a partnership with UN Global Pulse, where AI and NLP were used for transcription of radio, public radio stations, so speech to text listening pipeline that then generates data that can be fed into epidemic intelligence or social listening platforms. But really, what are, in addition to the technical aspects of work that we've been doing, also in trying to disseminate information into the information ecosystem, for example, through chatbots and other things, really, what are the aspects from our experience as informaticians of what we can contribute to the discussion of the infodemic? And governance is one. What we need to understand is that this overabundance, like the large volume of information, that's not new. When you think back to the creation of the World Wide Web, that was 32 years ago. We have 32 years of people producing and sharing any kinds of content without any kind of control. And the web was designed to be the most democratic place. The idea of it was to be chaotic, actually, by definition. So now, 32 years later, we're trying to put in rules to govern it. And what's really important in this point is that we remember that we won't make the infodemic go away. So we need to really be patient, stop and learn, and introduce tools and policies that will allow us to coexist with the infodemic. So our goal shouldn't be to control or eliminate it, because that won't be possible. If we really think that way, we will fail out of the spot on this place. But at WHO, we do have an infodemic management framework, and colleagues at PAHO have actually been thinking through what perhaps a governance process would look like that we need to implement that framework. So they've postulated that we need three main elements: to look at producers of content, look at consumers of content, and look at the people that are in the middle, so those that are sort of the intermediaries of information. But also, which is we need to remember, which is really, really important, and this is something that we try to reinforce to people in every conversation, is that everyone has a role to play to manage the infodemic. Because today the biggest problem that we have is that everybody thinks that infodemic management is another person's business. But we all have a role to play, professionally and personally. And we need to really be thinking what we can do to support the fight against the infodemic. The other area that I think we as informaticians have a lot of experience in and can contribute greatly in thinking about is information management perspective. So our colleagues at PAHO did an analysis of what has been published in scientific journals on dengue, Zika, and chikungunya, and all of the volume of the information that was published. They estimated that one person would need to read for 50 years nonstop to read everything that is published in this domain. So when we think about all of this, we really need to ask ourselves, are we publishing for the sake of publishing, or are we publishing what we actually need? So we really need to think about changing our own behavior at the time that we publish something, at the time that we produce content, at the time that we work with people in content production. And of course, we as informaticians can also develop new tools that are there to see or help us inform whether what we're working on is what really people are searching for. So we shouldn't be publishing or working on things just because we believe that we're making a contribution, but we really need to change the paradigm and work towards where the need is. So whether the health authority needs evidence or whether there's an active gap that people are searching for. So this is related to the second point, which is that we believe that we need to be more focused towards the general public, because practitioners or the academic community, we all know in a way how to search for information, how to identify it, how to work with evidence, and all of that. But that is not the situation in the general public. So, if you look at those who believe and subscribe to anti-vaccine narratives or interact with the tobacco company messages or climate change messages. So we need to have a better way of understanding how to reach the general public. We know how to lead with the evidence, but not always how to reach the people. And that's actually really key, where also informatics tools could help us guide that a little bit. So what we really need to, in the end, really to understand is the entire circle of information production. And this is why also from the policy and governance perspective and information management perspective, what is key here is multi-sectoral and interdisciplinary approach. So this is what the colleagues in the Americas with leadership of the PAHO colleagues are doing. And really with the main premise that we're not only talking about mis or disinformation or fake news or fake data, because we really need to remember that the infodemic is also about the overabundance of information, and that information may be good information. So again, coming back to the main premise that then it becomes more important to understand what the needs of the people are, what are people searching for, how people are interacting with technology, and what are the tools that we can make that are available to help us diagnose that. So from that perspective, because we know that the infodemic, cannot be eliminated, it is staying with us forever with the way that internet is. We really need to work on early education. So the way that I think about it is similar to how We have organized, for example, fight against non-communicable diseases, where as part of primary education in schools, we talk to children about healthy foods, healthy eating, healthy lifestyle. And we need to do the same with the primary education about information access, digital literacy, information literacy. We need to teach young people how to search for information and understand the digital ecosystem so that later on, when they're older at professional level, but also through all of their stages of their life, they will understand very well how to deal with fake information or abundance of information. And that sort of brings me to my last point, which is that I feel that another actually big contribution, in my opinion, of our field has a lot to do with our experience in human-centeredness, user experience. Because the only way to enable healthy behaviors in people is to have this holistic human-centered view of what do they need, how are they feeling, how can they enact health behaviors. This is not just a matter of, oh, as long as a person would have information, they will make a decision and they will act on it. The drivers of human behavior are a lot more complex. Just like, for example, and I got this lesson basically the first month of my graduate school when I started studying biomedical informatics. And in my clinical informatics class, the first month I spent in an assignment in a teaching hospital, basically shadowing a team of nurses and a team of doctors in an emergency, in an intensive care unit. And my job or my task was to observe how they organize information, how they share information with each other, how they record it on boards, how do they record it in other ways, and how they work together so that they provide care to the patients. And this was an exercise in human-centeredness. It was an exercise in actual qualitative research methods that basically stayed with me for all of my career. And I feel that that perspective from our practice, from digital health implementation of information systems and products, that is the perspective that is needed, the human-centeredness that is needed to be much more strongly represented in the public health practice if we want to reinforce healthy behaviors in people. Now, our profession is not the only one in public health that's thinking about it. Social behavioral science in several other parts of public health is also very much thinking about what drives people's behaviors. But I think this is a perspective that we're very comfortable with. And of course, we need to also reaffirm that human-centeredness is not only about product design. It's also about how we work with people and how we organize ourselves and how we work with our colleagues. So if we use these types of approaches, we would be able to also address the biggest pain points, the vulnerabilities in information ecosystem, in how people are searching information, etc., to contribute to managing of the infodemic. And then, lastly, I'd like to just reiterate again, we absolutely, as informaticians, as digital health practitioners, we are also very comfortable, I think, with thinking about how technology is changing society. This is the premise of what we've been trying to do with the digital transformation and introduction of the digital transformation into the health sector, where technology is really changing how we work and how we live and gather and learn, etc. But as you know, the digital transformation in the health sector has been lagging behind some other sectors, and we need to really make a concerted effort to help the health system catch up. This is not anymore only about the digitization piece, but these human nuances of how technology is affecting and challenging public health practice and the health system. In a digitized space, in a digitized world that now is very much focused on achieving collective health behaviors. We, through our insights and through our experience, need to be a part of the solution, not only with the computational and tools and products that we know how to build, but actually the softer side of informatics and experience that we have in information management, etc. Because it all really comes down to understanding that ultimately we serve humans and that we work in human teams to design technologies that then serve the needs of individuals and communities. So I would like to conclude with this, and I will be very happy to receive any questions from you on email or on LinkedIn, and I hope you have a good rest of today with very interesting discussions.
Thank you.
Muchísimas gracias a Tina Purnett por acompañarnos desde Ginebra con esta extraordinaria presentación sobre Infodemia, uno de los principales problemas a los que nos hemos estado enfrentando en estos últimos 2 años en el marco de la pandemia de COVID-19. Muchísimas gracias a la audiencia. Si tienen preguntas, compártalas en nuestro canal de YouTube. Vamos a estárselas haciendo llegar a Tina y estoy segura que va a responderlas, y de igual forma compartiremos sus respuestas a través de ese medio. Quiero invitarlos a la siguiente actividad que está a punto de iniciar. Voy a compartirles aquí en el chat el link para que puedan unirse. Decía al inicio, una de las actividades más esperadas de este foro, porque vamos a estar hablando sobre el rol que juega la cooperación internacional en la transformación digital del sector salud. Muchísimas gracias a todos por acompañarnos. Me despido de ustedes y nos vemos en la siguiente actividad. Un abrazo. Hasta pronto.